Hey, hello, and welcome to the CDO Magazine interview series. I'm Michael Hejtmanek, the VP of Corporate Solutions and Consulting at Nudata. Nudata is the world's largest data advisory service with offices in London, New York, and Shanghai. Basically, our job is to help help to know everything there is to know about all the available data sources that exist and how the market consumes them, so that we can help data buyers choose the right data and help data providers find the best path to market to maximize revenue from data sales. Today, I've got the pleasure of speaking with Beth Falder, the AVP of Data Analytics at Nuvance Health. Nuvance is a healthcare system operating hospitals and medical centers in the northeastern United States. So, Beth, welcome, and thanks for spending some time with us today.
Thanks for having me, Michael.
So, why don't we jump right in by having you tell us a bit about yourself and Nuvance to set the stage for a discussion about some of the ways that data moves the needle at Nuvance.
Sure, absolutely. So, as Michael introduced, I am Beth Falder. I am the AVP of Data Analytics here at Nuvance Health. What does that mean? I am the lead data person for the organization, and we look at data from all aspects, from our clinical applications through our HR systems, supply chain, some of our patient experience surveys, quality outcomes, really running the full gamut and depth and breadth of the data that is available to us. As you said, we are a healthcare delivery network here in Connecticut and New York, serving the communities around the area and always looking to leverage data to the maximum capabilities to enhance what we provide to our communities.
Great. So can we just start off by talking about some of those ways that you use data to enhance those capabilities? What are those key data initiatives and how are they driving value creation across everything from HR, operational, clinical outcomes, what have you?
Sure. We started a few years ago, really, before we were disparate data systems. We are a new organization, so we merged two health systems into one in 2019. Rapidly had to pivot in 2020 due to the COVID outbreak and started there on, how can we support our clinicians reacting in near real time to what was happening in our hospitals and our communities. From there, it became very apparent that we needed a different way to do business. And so we started on our cloud journey. So partnered with AWS to bring all of our data up into a cloud environment, and then started with what were the key strategic initiatives that we needed to address. So partnering with all the way from the CEO down, what are the KPIs for the organization? How can we bring those to life? How can we make it easy for not just our leadership team, but our managers, our boots on the ground to know how we're performing on those key initiatives, and then trickling down to their areas to how it relates to how we do business on a day-to-day basis.
It sounds like a great functioning organization where you've got leadership at the very top levels of the organization setting those goals and working together across the organization in all different areas of the organization to make things happen. How do you measure success for those initiatives?
So those we keep very close eye on. So we have our strategic scorecard that represents every aspect of the business and aligning that to some of our key service areas. That's reviewed regularly at our CEO meetings, at our business initiatives, to make sure everybody knows how we're performing. And then we do more enhancements to support those key KPIs so that they can see what other aspects are going to drive performance to where we need to head.
Right.
It's never ending, as I'm sure all data leaders know. Once you give people a little piece of data, they want all the data. And
Right.
so
Right. Right.
really the
Is
next aspect for us is creating more of a data product mindset so that we can springboard to self-service capabilities and empowering our end users to interact with the data in a more meaningful way, and going from reacting to past performance to really proactively saying, what is my next best action to drive improvements in our new areas?
Oh, that's fantastic. That sounds like that'll really drive efficiency and operational effectiveness throughout the organization. That's a great move. So shift gears a little bit to the topic that everybody's talking about. It feels like beating a dead horse, but everybody's talking about AI and how is AI being integrated into your plans in 2025 or beyond? And what does it look like for Nuvance or even the industry, the healthcare industry in general?
For sure. And it's ironic. AI has been around in healthcare for a very long time. We've had these predictive models to help drive care plans and all sorts of good things. But funnily enough, in 2023, it became top of mind for everyone. So that has springboarded a lot of initiatives. We have two tiers to our AI strategies. One's what vendors can we partner with to embed AI into our clinical systems themselves? So those require further oversight and regulation, FDA approvals. That's not an area that we would look to really dive into. So we'll partner with trusted advisors and partners that we can really use their tools. The second is our internal AI capabilities. And that's where we really want to leverage our investment in cloud to move forward with those strategies. So we've done some preliminary, what business problem do we want to solve? What is an AI solution that we can put in place for that to wet our feet? And then from there, what we're really looking to leverage is building a multimodal cloud environment that we can put on top of that, some of the AI tools available in cloud to empower our businesses and drive further outcomes and improvements.
Cool. How does the implementation of these programs affect the data that you're using or the structure of the data? And you touched upon security with the AI models, but what's impacted from the data perspective?
It's huge. And I'm sure we're not alone in saying our data isn't as structured or as clean as we would like, nor is it ready to just fully load into an AI model and hope for the best. So for us, we are very lucky in that healthcare already has a standard for data. It's called the FHIR standard. So it's an international standard for healthcare data. We are actually leveraging those FHIR capabilities to then embed into our AI platforms so that we can have a little more trust in our data. Alongside that, leveraging some NLP capabilities so that we can look at some of that unstructured data that we really haven't had insight into before, put it into a translatable, structured manner so that AI can sit on top of that too and provide value.
Yeah, and with some of that unstructured data, I think about, variation codes, variants of CMS codes and how it gets from organization to organization, their standardization sort of falls apart. And does AI help to sort of structure that? You mentioned sort of having some data is unstructured, some data is maybe a little messy. Is AI helping clean that data up? Is that one of the uses?
Absolutely. And that's where we look to our cloud vendors to help us solve some of these problems. We are leveraging some of our AWS tool sets that are healthcare specific, and they look at the lexicon of healthcare related data so that they can translate meaning from those physician notes or those RN notes or procedural notes from the surgeon. That's where we really want to gain the most insight because there's so much information there that we've never really been able to leverage before. And that's what we're hoping to springboard this year.
Great. Well, cool. Well, thank you, Beth. Thanks for joining me today. And for any listeners, for more interviews and insights, visit cdomagazine.tech. Thank you very much.
Thank you.